Hi, I'm Anya Suica, and with me is Dr. Sheryll Beltran-Carullo. Doc Sheryll is affiliated with the Baguio General Hospital, Notre de Chartres Hospital, and Lorma Medical Center. Wow, from the north.
Yes.
Okay. So, ang first po nating tanong, para lang din so everybody can become more familiar with questions about fertility or infertility, ano pong kailangan tandaan ng mga mag-asawang gustong mabuntis?
Okay. So actually, maraming factors na kailangan i-consider. But it has to start with lifestyle modification. So we have to have at least normal body mass index. And the general, usually mga ina-advise namin is to avoid smoking, alcohol consumption, drinking caffeinated beverages, and of course, if they really want to get pregnant, they have to have regular intercourse. Kasi most of the patients, minsan pupunta sa'yo, the husband pala is abroad, or they're not living together. So, that's a very basic. You have a regular intercourse. Meaning, at least every 2 to 3 days of a sexual intercourse. And at the same time, if they do not get pregnant within a year of unprotected intercourse, then they should seek counsel. Okay? But if the patient is, or especially if the female is more than 35, if they do not get pregnant within 6 months, then they have to consult a doctor initially.
Okay. So, yun na po yung mga tips para alam po natin kung paano mabuntis. So, we asked the audience po kung ano po yung mga questions nila for the doctors. Tas, ito po yung isang case that came in. Hopefully, you can also give your advice. How to get pregnant po, 2 years na kami nag-try. Yung mattress ko, hindi pantay ang butas. Sa madaling salita, mahirap makapasok ang fluid paloob. I'm 36 years old na, may maliit akong myoma, nagpa-check up na po ako, binigyan ako ng gamot, folic acid, and vitamins. Thanks po.
Okay. So, the patient's already 36, or she's already 36 years old. Now, as I've said earlier, if you're 36 and above, and despite the efforts of getting pregnant, hindi ka pa rin nabuntis within 6 months, then you should consult already an infertility doctor. More so that in the patient's case, she's been trying for the past 2 years.
2 years na nga
Yes.
po.
Dun sa sinasabi niyang something sa orientation ng mattress, marami kasing causes, and she has to undergo thorough fertility workup to check, kasi baka hindi lang naman yun yung defect. Baka may problem siya with ovulation or menstruation, she has problems with sa fallopian tubes, baka block siya, or yung husband niya baka may problem din. So, may advice is to consult an infertility doctor, and of course, para malaman yung ano yung possible options for her case, mas thorough yung diagnostic test na gagawin sa kanya. And of course, she's already 36, so talagang treatment niya is already on.
Okay, sige po. That's very helpful, Doc. Sana natulungan natin yung mga couples na maraming tanong tungkol sa fertility. Thank you for joining Baby Goals. And thanks for watching. Stay tuned for more information to help you meet your baby goals.